are several types of injectables that are available for patients. Generally, they're classified into the neurotoxins, such as Botox, which is used to reduce wrinkles, and then the fillers. And fillers basically range from permanent to semi-permanent to temporary. The temporary fillers are mainly the ones composed of hyaluronic acid, and that's Juvederm, Restylane, and Perlane. Then you have semi-permanent fillers, such as Radius, which is calcium hydroxylapatite, and that's actually the mineral component of bone and teeth. And it's important to note that both the hyaluronic acid products, like Restylane, and the calcium hydroxylapatite products, like Radius, they're both natural products that are found in the human body. Radius, being a semi-permanent filler, lasts longer than Juvederm and Restylane. Some say up to maybe a year or so, perhaps longer. But more important than that, it helps generate collagen. And so you'll have some permanent volume enhancement after the product dissipates. And then there are considered permanent fillers. Permanent fillers include Sculptra and Bellafill. These generally require more than one injection over a period of time, but can typically last the lifetime of the patient. And that's important to know because many patients who wish to look younger ask for Botox. And in fact, I would tell you that I don't think Botox makes people look younger. It may make them look better and their skin more attractive, but to really restore youth, you typically need to add volume, and that's where these fillers come in. And the volume we place are in areas where there's either tissue descent. For example, as we age, the cheeks fall or hollowed out under the eye. As this falls, we hollow out in the folds. And we also hollow out in the temples and even develop wrinkles in the corner of the mouth. Botox doesn't really address that. Botox addresses the wrinkles from your forehead elevation to smiling and to the 11s when we do that. They both have a role, of course, in rejuvenation of the face, but they act much differently. The procedures for all the injectables take generally 5 minutes to 30 minutes depending on what we're doing. The downtime is minimal. Sometimes there's swelling and bruising, but even that's unlikely. With Botox, the results generally don't kick in for 3 to 5 days, as opposed to the fillers, which act immediately. For instance, when someone leaves the office with Botox, you won't see an improvement in their wrinkles, not for 3 to 5 days. When they leave the office with fillers, there'll be an immediate result. Products like the fillers, in fact, can also be used to remodel the face and improve the facial architecture. For instance, people that are generally younger, that aren't aged or don't have the hollowed out eyes, can have a more chiseled face or higher cheekbones, or even just a new look by adding volume to either the jawline or the cheeks or the temples. And that's a really interesting application of injectables that we use now. When we do facial remodeling, as I like to call it, some products are permanent and some aren't. So we can remodel the face for 6 to 8 months. Depending on what product we use will determine the longevity of the results. Fat grafting is permanent, and that can give you a different look with higher cheekbones or a stronger jawline permanently.